All right, ready to dive deep into CBT. I know a lot of you have been asking about this one. It seems like CBT is everywhere these days, but what's the hype really all about? We've got some excerpts from this article exploring cognitive behavioral therapy, and I think it's going to help us unpack it all.
Yeah, it's really interesting how CBT has become so popular, both for therapists and people looking to improve their mental well-being.
Yeah, so let's start with the basics, right? The article gives us a pretty straightforward definition. CBT is about understanding the connection between our thoughts, our feelings, and our actions. But, and this is key, it's about making changes in the present moment.
Right, right. It's very much a present-focused therapy.
That's super interesting. Unlike some other therapies that might delve into your childhood or past experiences, CBT is all about tackling those negative thoughts and patterns that are tripping you up right now, today.
Absolutely. That shift from past to present is something that really set CBT apart when it first emerged back in the 50s and 60s.
Yeah.
Like pioneers like Aaron Beck and Albert Ellis, they wanted to create a therapy that was more immediate, more actionable.
That makes total sense. So no dwelling on childhood traumas or anything like that. It's about taking control of your thoughts and actions right now.
Yeah, exactly.
Okay, so less talk, more action, right? That's what I like to hear. So how do we actually do that? What are the secret ingredients, the magic tools that make CBT so effective?
Well, there are two key components that really make CBT tick: cognitive restructuring and behavioral activation.
Ooh, that sounds pretty intriguing. Break those down for me. What do those even mean?
Okay, so cognitive restructuring is all about identifying and challenging those distorted or irrational thoughts that can fuel negative feelings and behaviors.
Okay, so it's like recognizing those mental traps we fall into, the kind of thoughts that make us feel anxious or down, and then figuring out how to reframe them in a more balanced way.
Yeah. Like, those times when you catch yourself thinking, oh, I'm such a failure, just because of a small setback? CBT would help you to, like, pause, examine that thought and ask yourself, is that really true? Or is there a more helpful way to look at this situation?
I see, I see. So it's about recognizing that our thoughts aren't always accurate reflections of reality,
Right.
right? And that we have the power to shift them in a more positive and realistic direction.
Exactly. It's about gaining control over those narratives that are running in your mind.
I love that. It's like taking charge of the stories we tell ourselves. Okay, so that's cognitive restructuring. But what about this behavioral activation thing?
Right. So behavioral activation is all about taking action, getting out there, and engaging in activities that bring you a sense of pleasure or accomplishment, even if it means facing some fears or discomfort along the way.
So it's not just about changing your thoughts, but actually changing your actions. Yep. Wow, this is where it gets really interesting. But like, what if you're feeling stuck? You don't even have the energy to do anything. How does behavioral activation help with that?
That's where the whole idea of starting small comes in. Let's say you've been feeling down and withdrawing from things you used to enjoy. Behavioral activation wouldn't tell you to just suddenly run a marathon or become like a social butterfly overnight.
Right.
It's about taking tiny steps, maybe going for a short walk in nature, reconnecting with a friend, even just tackling a small task that you've been putting off.
I see, I see.
The idea is that by gradually increasing your engagement in positive activities, even the little ones, you start to break free from those negative cycles of avoidance and inactivity.
That's actually really powerful. It's like building momentum one step at a time.
Right.
Okay, so we've got cognitive restructuring, the thinking part, and we've got behavioral activation, the action part. But how do these two work together? Like, what does that look like in practice?
That's the beauty of CBT. It combines those two in such a powerful way. So imagine, for instance, you're someone who struggles with social anxiety.
Yeah, a lot of people can relate to that.
Through cognitive restructuring, you might challenge those anxious thoughts like, everyone's judging me, and replace them with more realistic ones like, most people are probably too focused on themselves to even notice me.
So you're shifting your perspective to a more balanced and realistic viewpoint. But then what? Where does the action part come in?
That's where behavioral activation comes in. So you might start by attending a small social gathering, maybe just a coffee date with a close friend, something low-key.
Right, like dipping your toes in the water.
Exactly. And as you navigate those situations and realize that they're not as scary as your anxious thoughts predicted, it starts to chip away at that anxiety.
Yeah.
You're building up evidence that those worst-case scenarios that your mind creates are usually way off base.
Oh, I see. So the positive experiences you gain through action, they actually reinforce those new ways of thinking. It's like a positive feedback loop.
Exactly. You're tackling those negative thought patterns while simultaneously taking concrete steps to create positive experiences, which then reinforce those new ways of thinking and behaving.
This is making so much sense. Now, the article we have here specifically mentions how CBT is used for anxiety and depression, which, let's be honest, are two super common issues that I think a lot of people struggle with these days. So let's dive into how CBT tackles each of those, shall we?
Let's do it. So with anxiety, we often see a lot of what we call catastrophizing, those what-if thoughts, what if this happens? What if I can't handle that?
Yeah, that spiral of worry.
Exactly. CBT helps you to kind of hit the brakes on those runaway thoughts, like, are those worries really true? What evidence do you have to support those fears?
So you're helping someone to see that their thoughts might be exaggerating the situation, kind of blowing things out of proportion.
Exactly, yeah. And then alongside that, CBT brings in the behavioral activation piece we were talking about. Remember, it's about doing things that bring you joy, even if it means facing some of those fears head on. So for someone with social anxiety, it might be starting with small social interactions and gradually, building up to larger ones.
Okay, so like instead of avoiding parties altogether, maybe starting with a casual lunch with just one friend.
Exactly. And as they experience those situations going better than those anxious thoughts predicted, it starts to chip away at the anxiety. It's like they're gathering evidence that their fears are often unfounded.
I love how CBT combines that mental shift with real-world action. Okay, so we've tackled anxiety. What about depression? How does CBT approach that, especially when people might be feeling so low on energy?
Yeah, depression can be tricky because it often involves a lack of motivation and energy, which makes it even harder to take action. And that's where a specific type of CBT called mindfulness-based CBT, or MBCBT, be really helpful.
Ooh, mindfulness is such a buzzword these days. What's so special about it for depression?
Mindfulness is all about, like, paying attention to the present moment without judgment.
Okay.
And this is key for depression because it helps you step back from those negative thought spirals that can just keep you feeling stuck. Instead of being totally consumed by thoughts like I'm worthless or nothing good ever happens, mindfulness helps you to observe those thoughts without getting completely entangled in them.
Okay, so it's about creating some distance between yourself and those negative thoughts so they don't have as much power over you.
You got it. Now, the article you shared highlights three key elements of MBCBT: mindful observation, acceptance and commitment, and cognitive diffusion. Let's unpack those a little bit.
Yeah, let's do it. I'm curious about how those pieces all fit together.
So we've already talked a bit about mindful observation. It's that practice of just noticing your thoughts and feelings without judgment, like you're a curious observer of your own inner world.
Yeah, I can see how that could be really helpful, especially for someone like me who overthinks everything. Instead of getting lost in my thoughts, I could learn to just observe them, without getting all worked up about them.
Exactly. Now, acceptance and commitment. This is where things get really interesting. It's about acknowledging that those difficult thoughts and feelings are a natural part of life. We don't have to fight them or push them away. Instead, we can learn to just accept them, make space for them, and still move forward in a way that's aligned with our values and goals.
So even if I'm feeling sad or anxious, I don't have to let those feelings dictate my actions. I can still choose to do things that matter to me, even if it's tough.
That's it. It's about taking action despite those feelings, not waiting for them to magically vanish before you start living your life. And that brings us to cognitive diffusion, which I think is one of the most powerful aspects of MBCBT.
All right, I'm ready. What's this cognitive diffusion all about?
Cognitive diffusion is about learning to see your thoughts as just thoughts. Like they're just mental events, not necessarily truths or commands that you have to obey.
Wait, hold on. My mind is blown. Are you saying our thoughts aren't always facts? We don't have to believe everything we think?
That's exactly it. It's a game changer. Imagine, like, your mind is a radio, okay? It's constantly broadcasting all sorts of chatter and noise.
Okay.
With cognitive diffusion, you learn to change the channel, to turn down the volume on those thoughts that aren't serving you.
I love that analogy. It makes so much sense. So instead of getting hooked by every thought that pops into my head, I can learn to recognize it. Oh, that's just a thought. It doesn't necessarily mean it's true.
Exactly. And this can be so freeing because it lessens the power those negative thoughts have over your mood and your behavior. You don't have to be ruled by them anymore.
Wow, this whole idea of MBCBT is really resonating with me. Okay, so we've explored the core principles of CBT, how it can be used to tackle anxiety and depression, and even dipped our toes into the world of mindfulness. Now, I'm curious about something the article mentions, DIY CBT. Is that even possible? Can you really do CBT on your own?
Yeah, totally. It's definitely possible to get started with CBT on your own. There are a ton of great self-help books and workbooks out there. In fact, the article even recommends a few, like Mind Over Mood, the Cognitive Behavioral Workbook for Depression, and the Anxiety and Worry Workbook.
Okay.
These resources, they can give you a really good introduction to the principles and techniques of CBT, especially if you're just starting out.
That's great to hear, but I'm guessing there are some limitations to doing CBT solo, right? It can't completely replace working with a therapist.
Of course, while self-help materials are a great starting point, they can't really replace the guidance and support of a trained therapist, especially if you're dealing with more severe symptoms or just feel like you need that extra level of support.
Right. It's kind of like learning to play guitar. You can teach yourself the basics with online tutorials and books, but having a teacher can really help you progress faster and avoid developing bad habits.
That's a great analogy. A therapist can help you tailor those CBT techniques to your specific needs, give you feedback and hold you accountable, and also guide you through those challenging moments that will inevitably pop up along the way.
It's like having a personal trainer, but for your mind.
Exactly. And speaking of trainers, there's another important aspect of CBT that we should mention, and that's the therapeutic relationship itself. It's not just about the techniques, it's about the connection between the therapist and the client.
Oh, yeah, that human element. That's something I'm always emphasizing. Connection is key.
It's essential. CBT provides these amazing tools and techniques, but it's that relationship that really brings them to life. A good therapist creates a safe and supportive space for you to explore your thoughts and feelings, encourages you, provides guidance, and really personalizes the approach to fit your unique personality, your values, your life experiences.
It's like that trust and rapport allows you to really open up, to try out these new ways of thinking and behaving, and to embrace the transformative potential of CBT.
Yeah, for sure. And it's important to remember that CBT is a collaborative process. The therapist isn't there to judge or tell you what to do. They're there to partner with you on your journey towards better mental well-being.
So it's about finding a therapist who's a good fit, someone you feel comfortable with, someone you trust to be vulnerable with, who really understands your perspective and your goals.
Absolutely. Now, before we move on, I want to address something that I think is a common misconception about CBT. It's
Yeah.
not about putting on this happy face or pretending that everything is perfect.
Right. It's not about denying or suppressing those negative thoughts and feelings, is it?
Not at all. CBT acknowledges that negative thoughts and feelings, they're a part of being human. It's not about eliminating them entirely. It's about developing a healthier, more balanced relationship with them.
So it's not about being happy all the time, but about learning to manage those difficult thoughts and feelings in a more constructive way.
Exactly. CBT gives you practical tools to examine those thoughts, challenge their accuracy and helpfulness, and ultimately choose how you respond to them instead of letting them control you.
That sense of choice, that sense of agency, it's incredibly empowering, right?
Absolutely. It's about reclaiming your power over your own mind. Now, earlier we mentioned all that research supporting CBT's effectiveness, all those studies that have been done. I know you're all about evidence-based approaches.
No, you know I am. Always got to see the data. So spill the tea. What does the research actually say about CBT?
Well, there have been countless studies on CBT, especially over the past few decades, and the results are really impressive. They consistently demonstrate its effectiveness for things like anxiety disorders, depression, insomnia, PTSD, even chronic pain.
Wow, that's quite a range. So it's not just hype. There's real science backing up CBT's effectiveness.
Exactly. And the research doesn't just show that it works, it also provides some insight into how it works. Like, some studies have shown that CBT actually leads to measurable changes in brain activity, particularly in areas related to emotion regulation, decision-making, and stress response.
So it's actually rewiring our brains for the better. That's fascinating.
In a sense, yeah. CBT helps you develop new neural pathways, strengthens the ones that are associated with healthier thinking patterns and coping mechanisms. And that's part of why CBT is often considered to be a long-lasting treatment. It's not about just masking the symptoms. It's about creating some fundamental shifts in how you think, feel, and behave.
I love that. It's like giving our minds a serious upgrade. But okay, let's be real. No therapy is perfect, right? Are there any limitations or drawbacks to CBT that we should acknowledge?
That's a great question. And yeah, it's important to be honest about the potential challenges of any therapeutic approach. So while CBT is generally considered to be pretty safe and effective, it does require commitment and active participation from the individual. It's not like you just lie on a couch and talk about your feelings.
Yeah, it's not a passive thing.
Right. It involves actively engaging in homework assignments, practicing new skills, and really challenging those ingrained thought patterns.
So it's not a quick fix. It takes effort, dedication, and a willingness to step outside of your comfort zone.
Yeah, you got it. But I think that's also where the real rewards lie. The effort you put into CBT, it can really lead to lasting change.
Right, like anything worth having, it takes work. Another potential challenge I can think of is finding a qualified CBT therapist, right?
Hmm.
With CBT being so popular, I imagine there are a lot of therapists out there claiming to specialize in this approach. So how can someone ensure they're finding a therapist who's legit?
That's a really important point. Definitely do your research and find someone who has the proper training or credentials. Like look for therapists who have credentials from reputable organizations, like the Academy of Cognitive Therapy or the Association for Behavioral and Cognitive Therapies.
So don't be shy about asking those questions, ask potential therapists about their experience, their training in CBT specifically. And of course, finding a therapist who's a good personal fit for you is crucial too.
Absolutely. Now, you brought up something earlier about CBT's emphasis on the cognitive realm, like our thoughts and beliefs. And I'm wondering, is there a downside to that focus? Could we be missing something by putting so much emphasis on our thoughts?
Ooh, that's a great question. Like, are we neglecting the emotional or even the physical aspects of our experience?
Right. It's a topic that's been debated within the field, for sure. Some critics argue that CBT's emphasis on thoughts can sometimes, overshadow the importance of emotions, bodily sensations, and even spiritual or existential concerns.
It's like we're only looking at one piece of the puzzle if we just focus on the cognitive level.
Exactly. And that's where integrating CBT with other therapeutic approaches can be really valuable. Like blending CBT with mindfulness, somatic experiencing, maybe even psychodynamic therapy. We can create a more holistic approach that acknowledges the complexity of the human experience.
Yeah, it's about recognizing that our thoughts, emotions, our bodies, even our spiritual beliefs, they're all interconnected and influence each other.
Totally. And by addressing all these facets of ourselves, we can create a more well-rounded and sustainable path towards well-being. Now, before we wrap up this section, I wanted to touch on a topic that often comes up in the context of CBT.
Medication.
Ah, yes, the age-old debate. Therapy versus medication.
Right. And I think it's important to emphasize that CBT and medication aren't mutually exclusive. They can actually work together very effectively.
So it's not an either situation. It's about finding the right combination that works for each individual. Exactly. Like for some people, medication can be really helpful for managing symptoms, stabilizing mood, which then allows them to really dive into that cognitive and behavioral work of CBT. And then for others, CBT can be a really powerful tool for reducing their reliance on medication, or even potentially tapering off it completely, of course, under the guidance of a medical professional.
It's all about finding that right balance, that personalized approach.
Exactly. And I think that's such an important message. Mental health care, it's not one size fits all. What works for one person might not work for another, and that's totally fine. The important thing is to find what feels right for you, what empowers you, and what helps you move towards a better sense of well-being.
I love that. It's about honoring our own unique journeys.
Couldn't have said it better myself. Now, I know we're eager to see CBT in action, to see how it can be applied in different areas of life. Let's take a look at some real-world examples.
Sounds good to me.
So, one area where CBT has had a huge impact is stress management.
Okay, stress management. That's something I think we all need a little help with these days. But is CBT about, getting rid of stress completely? Because, honestly, who doesn't have stress in their life?
Well, yeah, eliminating stress entirely, that might be a bit unrealistic.
Right.
But what CBT can do is help you change how you think about stress and how you react to it. It starts with understanding that stress, it often comes from our own interpretations of events, not necessarily the events themselves. It's not what happens to you, but how you react to it.
Oh, I've heard that saying before. Makes sense, though. Two people can experience the exact same thing, but their stress levels could be totally different.
Exactly. And that's where CBT can be so helpful. It gives you the tools to, challenge those thoughts and beliefs that are just amplifying your stress. Let's say, for instance, you're constantly stressing about things that are completely outside of your control.
Oh, yeah, I do that all the time.
CBT would encourage you to, reframe those worries, redirect your energy towards the things you can actually influence.
So instead of feeling totally powerless and overwhelmed, you're shifting into problem-solving mode.
Yeah, exactly.
I like that.
And, on the behavioral side, CBT for stress management often includes things like, relaxation techniques, learning some time management skills, even assertiveness training, things like that. These are all practical tools that can really make a big difference.
I love how CBT is so action-oriented, It's not just about thinking differently. It's about giving people tangible skills to manage their stress.
Absolutely. And, another area where CBT can be super helpful is relationships.
Oh, relationships. Yeah, that's a big one.
Right. I mean, think about it. Our thoughts, feelings, and behaviors, they all play a huge role in how we interact with others.
That's true for, like, romantic relationships, friendships, family, everything, really.
Exactly. So, CBT helps us see how our own baggage, our past experiences, our unresolved issues, they can kind of creep into our relationships
Yeah.
and create like these patterns of conflict or communication breakdowns.
So we're, like, unintentionally projecting our own stuff onto the other person without even realizing it.
Exactly. And CBT, it shines a light on those patterns, helps you challenge those unhelpful thoughts and beliefs and learn some healthier ways of interacting with the people you care about.
That can be so transformative for relationships. It's like you're getting this behind-the-scenes look at your own behavior, and then you actually have the tools to make positive changes.
Exactly. And, a big part of CBT in relationships is communication, learning to communicate more effectively. CBT therapists will often work with couples or families and help them learn how to express their needs and feelings,
Yeah.
how to listen without judgment, how to resolve conflict in a way that's actually productive.
So it's about creating a safe space for open and honest communication, but also learning how to, like, disagree without things getting totally out of control.
Right, exactly.
Yeah.
And, another key principle is that it's a two-way street.
Oh,
It's not about blaming the other person or trying to, change them. It's about taking responsibility for your own thoughts, feelings, and actions.
oh, that's so important. It's about owning your part rather than pointing fingers.
Right. Now, you mentioned earlier that CBT can also help to enhance performance, like in sports or other areas of life.
Yeah, yeah. This part really fascinates me. Like, think about athletes. They're under so much pressure to perform at their best, and CBT can give them that mental edge.
Oh, for sure. It's about training your mind as much as your body. Techniques like visualization, positive self-talk, goal setting, these can all help athletes overcome anxiety, stay motivated, and ultimately, reach their peak performance.
And those tools aren't just for athletes, right? They're helpful in any field where performance matters, like music, acting, public speaking.
Exactly. CBT helps people in all walks of life to identify and overcome those limiting beliefs that are holding them back, develop more effective strategies for reaching their goals, and cultivate a mindset that sees challenges as opportunities for growth.
It's like having a personal coach for your mind, guiding you towards your full potential.
Yeah, I love that analogy. And I think it really highlights the empowering nature of CBT. It's not just about managing mental health challenges, it's about helping us to thrive.
So we've covered a lot of ground today, haven't we? We've explored the history of CBT, its key principles, how it can be used to address all sorts of challenges, from anxiety and depression to stress, relationship issues, even peak performance. And I feel like I've learned so much about this powerful approach.
It's been a really fascinating journey.
And I think the biggest takeaway for me, and hopefully for our listeners, is that we have more control over our thoughts, feelings, and behaviors than we often realize. We're not just at the mercy of our circumstances or our past.
Absolutely. We have the power to choose how we interpret events, how we react to challenges, and ultimately, how we shape our own lives.
Well said. And we hope this deep dive has inspired you to learn more about CB2 and maybe even explore how it could benefit you on your own journey. So keep an eye out for more deep dives coming soon.
And remember, you have the power to change your mind. And in doing so, change your life.